Tumor versus cancer, understanding the differences. Tumor and cancer are two terms often used interchangeably, but they refer to different concepts in the realm of health and disease. To fully comprehend the distinctions between them, it is essential to delve into the intricacies of their definitions, characteristics, and implications. What is a tumor? A tumor is an abnormal growth of cells in the body. These cells multiply and accumulate in one area, forming a lump or mass. Tumors can develop anywhere in the body, including the brain, lungs, breasts, skin, and bones. They can be benign or malignant. Types of tumors. Benign tumors. Benign tumors are non-cancerous growths. They tend to grow slowly, do not invade nearby tissues, and do not spread to other parts of the body. They are typically encapsulated and do not have the potential to metastasize, spread. Benign tumors are often considered less life-threatening and easier to treat than malignant tumors. Malignant tumors. Malignant tumors are cancerous growths. They are characterized by uncontrolled cell growth and the potential to invade surrounding tissues and metastasize to other parts of the body. Malignant tumors can pose a significant health risk and are often associated with cancer. Characteristics of benign tumors. Well-differentiated cells. Benign tumors usually consist of well-differentiated cells that closely resemble normal cells in the tissue where they originate. Encapsulation. Benign tumors are typically encapsulated, which means they are contained within a fibrous capsule and do not infiltrate adjacent tissues. Slow growth. Benign tumors tend to grow slowly and do not exhibit the rapid, uncontrollable growth seen in cancer. Local effects. The effects of benign tumors are usually limited to the local area where they are present. They may cause symptoms depending on their size and location, but they do not spread to distant parts of the body. Characteristics of malignant tumors, cancer. Poorly differentiated cells. Malignant tumors often consist of poorly differentiated or indifferentiated cells, which may appear abnormal and bear little resemblance to normal cells. Invasive. Cancer cells have the ability to invade surrounding tissues and infiltrate nearby blood vessels and lymphatics, allowing them to spread to other parts of the body. Rapid growth. Malignant tumors grow rapidly and uncontrollably, crowding out normal tissues and interfering with their functions. Metastasis. One of the defining features of cancer is its capacity to metastasize. Cancer cells can break away from the primary tumor, travel through the bloodstream or lymphatic system, and establish secondary tumors in distant organs or tissues. Metastasis is a hallmark of malignancy. Causes of tumors. Tumors can develop for various reasons, including genetic mutations, exposure to carcinogens, viral infections, hormonal imbalances, and other factors. Here's how the causes differ for benign and malignant tumors. Benign tumors. The development of benign tumors is often associated with genetic predisposition, environmental factors, or chronic irritation. They are not typically linked to the same degree of genetic mutations or cancer-causing agents, carcinogens, as malignant tumors. Malignant tumors, cancer. Cancer is primarily driven by genetic mutations that lead to uncontrolled cell growth and the acquisition of invasive and metastatic properties. These mutations can be caused by a range of factors, including exposure to carcinogens, such as tobacco smoke, UV radiation, genetic predisposition, and viral infections, such as HPV, hepatitis B and C. Diagnosis and detection. Both benign and malignant tumors can be detected through various means, such as imaging studies, biopsies, and laboratory tests. However, the diagnostic process for these entities may differ in some aspects. Benign tumors. Benign tumors are often discovered incidentally during routine medical examinations or imaging studies, such as X-rays, ultrasounds, CT scans. In some cases, if they cause symptoms, they may be investigated further through biopsy or fine needle aspiration to confirm their benign nature. Malignant tumors, cancer. The diagnosis of cancer typically involves a combination of clinical evaluation, imaging studies, such as MRI, PET-CT scans, and biopsies. Cancer diagnosis is more urgent and critical because early detection can significantly impact treatment options and outcomes. Treatment and management. The approach to treating and managing benign and malignant tumors varies considerably due to their distinct characteristics and risks. Benign tumors. The management of benign tumors depends on their location, size, symptoms, and potential for complications. In many cases, surgical removal is curative and may be recommended to alleviate symptoms or reduce the risk of complications. Benign tumors often do not require aggressive treatments like chemotherapy or radiation therapy, as they do not have the potential to metastasize. Malignant tumors, cancer. The treatment of cancer is multifaceted and may include surgery, chemotherapy, radiation therapy, targeted therapies, immunotherapies, and other modalities. The choice of treatment depends on the type and stage of cancer, as well as individual patient factors. Cancer treatment aims to remove or destroy the primary tumor, control metastatic disease, and prevent recurrence. Prognosis. The prognosis for patients with benign and malignant tumors can differ significantly. Benign tumors. Most benign tumors are not life-threatening, and their prognosis is generally favorable. After surgical removal, the patient often experiences complete recovery, and the tumor is unlikely to return. Malignant tumors, cancer. The prognosis for cancer varies widely based on factors such as the type of cancer, its stage at diagnosis, and the overall health of the patient. Some cancers have high cure rates when detected early, while others may be more aggressive and difficult to treat. Prevention and risk factors. Preventing tumors and cancer involves distinct strategies and considerations. Preventing benign tumors. Benign tumors are not always preventable since their development may be influenced by genetic factors or chronic irritation. Reducing exposure to irritants or carcinogens, maintaining a healthy lifestyle, and undergoing regular medical checkups may help identify benign tumors at an earlier stage. Preventing malignant tumors, cancer. Preventing cancer often involves lifestyle modifications and strategies to reduce exposure to known risk factors. These may include quitting smoking, limiting alcohol consumption, protecting the skin from UV radiation, getting vaccinated against cancer-causing viruses, such as HPV, hepatitis B, and maintaining a balanced diet and regular exercise routine. Early detection through cancer screening is also a key preventive measure. In summary, while both tumors and cancer involve abnormal cell growth, they differ in crucial ways. Benign tumors are non-cancerous, slow-growing, and typically do not spread to other parts of the body. In contrast, malignant tumors, commonly known as cancer, exhibit uncontrolled growth, invade surrounding tissues, and can metastasize to distant organs. The diagnosis, treatment, prognosis, and preventive measures for these entities are distinct, emphasizing the importance of differentiation in medical practice and patient care. Understanding the differences. Thanks for watching. Subscribe for more video like this.